As a specialist with years of expertise, I've encountered countless elderly patients entering my clinic concerned about chest pain, shortness of breath, or abrupt tiredness. Frequently, the root cause isn't merely poor nutrition or anxiety. A drug they've been using for ages, sometimes even recommended to address another ailment. Many older adults are unaware that certain everyday tablets, taken by millions over 60, can silently harm the heart tissue, elevate blood pressure, or cause erratic heartbeats. These medications don't always reveal adverse effects immediately, but over time, they can diminish your heart's strength and reduce your lifespan. In today's presentation, I'll disclose the 7 most hazardous drugs that might be damaging your cardiovascular wellness without you even noticing. This isn't about alarm, it's about understanding. If you or a loved one is over 60 and using medications for discomfort, sleep issues, blood glucose, or emotional health, you must view this until the very end. Understanding these risks empowers you to make informed decisions about your health. The first drug is the most damaging and the most widely consumed. I'm not suggesting you halt anything without professional advice, but you have a right to understand the facts. So, let's start with drug number 7. Drug 7. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, include medicines like ibuprofen and naproxen. These are utilized for arthritis, joint discomfort, or backaches, frequent problems among older adults. Many individuals over 60 take them daily without recognizing how risky they can be to the heart. NSAIDs can increase your blood pressure and lead to fluid buildup, which places additional stress on your heart. For someone with a frail or aging heart, this extra strain might be sufficient to cause heart failure or irregular pulses over time. NSAIDs can harm blood vessels and impair kidney performance, further taxing your circulatory system. If you already have elevated blood pressure or use heart medications, these drugs can subtly disrupt your therapy. You might not sense the effects immediately, but your heart is under constant stress. That's why I always advise my elderly patients to be extremely cautious with over-the-counter pain relievers. There are safer alternatives for pain management that don't heighten heart risks. This caution is crucial for your heart's health and should be a priority in your medication choices. Always consult your physician before using NSAIDs for more than a few days. Pain relief shouldn't come at the expense of your cardiovascular health. Let's proceed to drug number 6, which is even more harmful over time. Drug 6. Certain diabetes drugs, thiazolidinediones. This consultation with your physician ensures that you are using medications safely and effectively. If you're handling type 2 diabetes, there's a group of medications called thiazolidinediones, including drugs like pioglitazone. These are intended to reduce blood glucose, but they might quietly damage your heart. These tablets can cause fluid accumulation, swelling in the limbs, and even result in congestive heart failure, particularly in those over 60. While the goal is to control blood sugar, the hidden danger to your circulatory system is significant. Many older adults with diabetes are already at high risk for heart conditions. When you add a drug that increases heart stress by causing the body to retain extra fluid, it becomes a risky combination. Even more concerning, these drugs can conceal early signs of heart failure, like exhaustion or difficulty breathing. Some physicians may still prescribe them because they manage blood glucose effectively. Still, if you have a history of heart issues or even slight swelling, this medication can quietly worsen damage. Always ask your doctor if a safer option is available. Your blood glucose is important, but not at the cost of weakening your heart. Let's now proceed to drug number 5, which millions of older adults are still taking for sleep every night. Drug 5. Sleeping medications, sedative hypnotics. Many older adults struggle with insomnia and depend on sedative hypnotic drugs like zolpidem or older medications like diazepam. These tablets promise improved rest, but they often bring severe consequences for your heart. Sedatives slow your entire nervous system, including your heart rate and blood pressure. While this might seem beneficial, It actually reduces your body's ability to handle stress or oxygen needs during sleep. Over time, these drugs can cause sleep apnea or aggravate existing apnea, condition where breathing pauses briefly during the night. This places immense stress on the heart and can lead to dangerous heart rhythm issues. Also, these medications can interfere with vital heart drugs, such as beta blockers, making your treatment less effective. The risk of falls, confusion, and breathing issues increases with age, especially for those taking other medications. Poor sleep must be tackled, but long-term reliance on sedatives can gradually harm your brain and heart. There are natural and safer methods to enhance your sleep. Without this harm, consult your healthcare provider before continuing any sleeping medication regularly. We'll now proceed to drug number 4, a common mood regulator that might be quietly damaging your heart without your awareness. Drug 4. Tricyclic antidepressants. Tricyclic antidepressants are older drugs prescribed for depression, anxiety, or chronic discomfort, including medications like amitriptyline or nortriptyline. These were once widely used but carry heart risks, especially for those over 60. These drugs can cause various cardiac problems, such as irregular pulses, blood pressure fluctuations, and even a serious condition called heart block. Over time, they can disrupt the electrical signals controlling your heartbeat. This makes them particularly risky for older adults who already have arrhythmias or a slow heart rate. These medications also heighten the risk of dizziness and falls, which can lead to injuries and further complications. Even if the dose is low, taking them for extended periods without monitoring can be harmful. There are newer antidepressants that are much safer for the heart and brain in older adults. Unfortunately, some physicians still prescribe these older drugs out of habit or cost concerns. If you're taking a tricyclic antidepressant and feel fatigued, dizzy, or experience heart palpitations, don't ignore it. Always ask your doctor if there's a safer alternative. Up next is drug number 3. Something millions of older adults take daily for a very common problem, but with hidden dangers. Before we proceed to drug number 3, here's something urgent. If you're over 60 and taking medications or want to safeguard your heart, download the Senior Wellness Monitor app now. It's designed specifically for older adults to track drugs, record symptoms, and detect early warning signs before it's too late. Most apps aren't tailored for people your age, but this one is. Due to high demand, we're only offering limited access this week, so don't delay. Stay safe, stay informed, and stay in control of your heart. You'll find the download link in the pinned comment and description box below. Download Senior Wellness Monitor today before your heart sends a warning you can't overlook. Drug 3. Decongestants, pseudoephedrine, and phenylephrine. Decongestants like pseudoephedrine and phenylephrine are found in many cold and allergy medicines. Older adults often use them to ease nasal congestion or sinus pressure, especially during seasonal shifts, but these tablets can be very harmful to your heart. They work by constricting blood vessels to reduce swelling in the nasal passages. However, they also constrict blood vessels throughout your body, including those supplying your heart. This increases your blood pressure and forces your heart to work harder. For older adults, this extra strain can be risky, especially if you already have high blood pressure or heart conditions. These drugs can also cause irregular heartbeats or palpitations. You might feel nervous, anxious, or even lightheaded after taking them. That's your heart signaling something is wrong. Many assume these drugs are safe because they're sold over the counter. But age alters how your body responds, and what once seemed harmless in your 40s can now pose a major heart risk. Always check labels carefully and consult your doctor before using any decongestant. Let's move on to drug number 2, one that older adults often take for long-term acid reflux without knowing its subtle effects on the heart. Drug 2, proton pump inhibitors, PP, is proton pump inhibitors, commonly called PP, are drugs like omeprazole or pantoprazole used to treat acid reflux and heartburn. Millions of older adults rely on these tablets daily, believing they're entirely safe. But recent research shows that long-term use can increase their risk of heart issues. PP is reduced stomach acid, which helps with reflux. But that same acid is crucial for absorbing key nutrients like magnesium. Low magnesium levels can cause irregular heartbeats, tiredness, and even muscle fatigue. Over time, PPIs can also disrupt gut bacteria and contribute to inflammation, which is directly tied to heart disease. If you're taking PPIs for more than a few weeks, especially if you're over 60, it's time to reevaluate. These drugs should only be used for short-term relief unless necessary. If you're experiencing ongoing heartburn, work with your doctor to find the underlying cause rather than masking it. Long-term heart wellness must always come first. Now it's time to reveal drug number 1, the most dangerous and widely used tablet that is silently weakening elderly hearts worldwide. Drug 1, calcium channel blockers. Calcium channel blockers are drugs often prescribed for high blood pressure, chest discomfort, or arrhythmias. Still, certain types, especially older ones like verapamil and deltiazem, can be risky for older adults. While these tablets effectively relax blood vessels, they can also slow the heart excessively. For older adults whose heart function may already be diminished, this can lead to dangerously low heart rates, lightheadedness, and even fainting. Over time, they may cause swelling in the limbs, shortness of breath, and heart rhythm changes. Some calcium channel blockers can also interfere with other drugs older adults commonly take, increasing the risk of complications. The biggest issue is that many older adults are prescribed these without regular oversight, and side effects may be mistaken for aging rather than the drug itself. Suppose you're experiencing tiredness, swelling, or a slow pulse while on these drugs. It could be a warning. Never stop heart medication without your doctor's guidance. But always ask if there's a newer, safer option for your condition. This drug is potent, but it requires close supervision. Now, let's summarize everything we've learned today. With a final thought, if you're over 60 and taking any of the drugs we discussed today, I'm not telling you to stop them on your own, but I strongly urge you to speak with your doctor. These drugs were designed to help, but when taken long-term or without proper oversight, they can gradually harm your heart. As a cardiac specialist, I've seen too many older adults hospitalized, not because of disease, but due to the side effects of their medications. The goal is not alarm, it's prevention. With the right knowledge and support, you can protect your heart, live longer, and feel healthier. Don't forget that tools like the Senior Wellness Monitor app can help you monitor symptoms, remind you about drugs, and keep your heart safer every day. Now is the time to take charge of your health. Stay informed, stay vigilant, and never hesitate to ask questions about the tablets you're taking. Your heart is too vital to overlook. If you found this presentation helpful, please share it with your loved ones and subscribe for more life-saving advice tailored for older adults like you. Take care and stay heart strong.